Well, hello again, science students. Mr. Michalski here, this time to review notes on diseases of the respiratory system. Not the most cheerful subject, but of course, with the COVID epidemic raging, very appropriate. So, if you have your notes, get them out. If you don't have your notes, maybe you want to pause this and get your notes out. Most diseases of the respiratory system can be classed as one of two things. They're either airway diseases, which affect the tubes through which air goes in and out of your lungs, right? So your larynx, your trachea, your bronchi, your bronchioles, all that stuff. Or they're lung tissue diseases, which means they actually attack the cells of your lungs or fill up the cells of your lungs and mess with them so that your lung cells can't absorb oxygen and get rid of carbon dioxide very well. So go through the list. This is not all of them, obviously. Things like laryngitis might qualify as a respiratory ailment, but we'll just go through the big ones that you've heard of a lot about. Asthma is an airway disease. It's where the bronchi and bronchioles get inflamed, and if you know somebody who has asthma attacks, they'll tell you they just feel like they can't get a deep enough breath of air. No matter how they try to breathe, they feel like get enough air. So it's treated with corticosteroids and inhalers. People with puffers. They're chemicals that are designed to make the tubes in the lungs relax a little bit so they can feel like they get a better breath of air. I'm not going to hit everything these notes say. I'm just going to hit the main points. Bronchitis, familiar one. It's an airway disease. It's about the bronchi. It's when the tubes going into your lungs get irritated and causes you to build up a lot of mucus and phlegm, and it hurts a lot. When you have bronchitis, it really hurts like thunder when you try to cough. And of course, your body wants to cough out the mucus, but that keeps the tubes irritated. So bronchitis can be a hard one to get rid of. Not life-threatening, but difficult to get rid of. Acute bronchitis is short-term. You have the cold or the flu, and you get bronchitis with that. Chronic bronchitis, chronic always means long time. So chronic bronchitis is long-term exposure to cigarettes. You're going to see this over and over in this section. Some people working with chemicals. Some people who have jobs in the freezer or refrigerated sections of warehouses for groceries and things. Cold air, constant cold air can cause bronchitis. Emphysema is typically a smoker's problem. It's a lung tissue disease. It's progressive, which means it gets worse and worse. And it's characterized by permanent sort of shortness of breath. Caused by cigarette smoking. There's no cure. People with emphysema can get treatment with antibiotics for secondary infections or steroids to ease up their breathing a little bit. I have a niece who's 30 years old who managed to give herself emphysema. It's typically an old person's disease because you need a lifetime of smoking to get it. But my niece is a heavy smoker, and she managed to give it to herself in record time. No cure for emphysema. It doesn't have to kill you, but you don't get rid of it. Asbestosis. You'll see commercials on TV with lawyers saying if you or somebody you know has been stricken with asbestosis or mesothelioma, call them and they'll sue somebody for it. And that's a lung tissue disease. You get it by being exposed to asbestos fiber. Asbestos used to be used in buildings to insulate hot water pipes and to fireproof sections. And they stopped using asbestos about 50 years ago because they realized it gives people cancer and asbestosis. But if you live in a house built before the 1970s, there might be this paper mache-ish looking plaster around the hot water pipes in the basement. That might be asbestos, and if it's painted over and it's not broken and it's not chipping, you leave it alone. It's not going to cause you any trouble. But if you ever have to renovate a house and tear out that kind of stuff, you have to get professionals in who have special air filters and spacesuits and all that, because asbestos fibers get in your lungs and they can cause a lot of mischief and you can't get rid of them. No treatment for asbestosis. Because it affects people in the building industry a lot, it's sometimes called an occupational disease. It's based, depending on your occupation, you may be more exposed to this. Lung cancer, lung tissue disease, affects the lungs, of course. You can read the symptoms. It's again most common. 85% of lung cancer patients got it from smoking cigarettes. Can be treated with surgery, radiation, chemotherapy. You can look at the symptoms there. I don't want you to freak yourself out thinking you have every disease we talk about, okay? Young people almost never get any of these things, okay? But pneumonia, an airway disease, the alveoli, the little air sacs deep in your lungs, can get infected and start swelling with fluid. And of course, swelling with fluid is not something you want in your lungs, and it makes it harder and harder to breathe. So that's where pneumonia is. Probably some of you have had pneumonia. It's no joke. You feel like you can't get a deep breath of air no matter what. But it's usually a germ-based thing, and treat it with antibiotics, and you get cleaned up. There's also vaccines for certain diseases. I'm looking through my pages of notes to find what I have to say next. Okay, tuberculosis, or TB. It's a lung tissue disease. It's a specific disease caused by a specific bacteria. And you can look up the symptoms in your notes. They're unpleasant. But not everything that gives you those symptoms is tuberculosis. I once had a really bad strep throat, where my throat was so raw that when I coughed, little specks of blood came out on the tissue. And the doctors said, well, let's x-ray you just to be sure it's not pneumonia, because there's some kinds of pneumonia where you cough up little specks of blood. I didn't have pneumonia, but they checked it out. If you're peeing blood or coughing blood, you always tell your folks about that and you get it checked out. You don't have tuberculosis. Probably all of you have had a vaccine at a young age. And for me to be a teacher, or for somebody to be a doctor or a nurse, you have to get a test called a Mantoux test, where they test you for antibodies to tuberculosis to see if you've ever been exposed. And I'm one of those people that has been. But I passed the test. All right, COPD. You'll hear more and more about this as time goes by. You'll meet people, older people, COPD. Lung tissue disease gets worse over time, brought on by cigarette smoking. And a lot of people who get COPD don't know it for a while, but they have more and more trouble breathing, especially when they go up the steps or they have to do something quickly. And since smoking is so addictive, a lot of people with COPD keep smoking, and it just gets worse. There's no cure, but treatments include medications, supplemental oxygen. When you see somebody walking around with oxygen tanks and little plastic tubes in their nose, it's almost always COPD. And finally, the one that's on everybody's mind this year is the COVID-19. You've heard more about that than I can possibly tell you in one class period. It's a lung tissue disease. It's a specific virus that attacks lung cells and damages them. While some people do become seriously ill, more than 8 out of 10 cases are mild with full recovery. Young people, like kids, don't die of COVID, really. And you will know some people that have had COVID. By the time we're all back in school in September, you'll know people who have the story, or maybe you will. Most people survive it, right? But it's scary because it's new. The best protection is prevention, and you've heard all this stuff. Sneeze into a tissue or your elbow. If you sneeze into a tissue, throw it in the garbage. Keep your hands out of your mouth, nose, and eyes. Wash your hands when you get home with soap and water for at least 20 seconds. Keep things clean, including remotes and doorknobs. And if you feel sick, stay home and get checked out. The COVID is obviously the biggest thing in the news these days, but as a society, we're going to survive it, and we're going to recover, and we're going to find some way to go back to living a sort of normal life, but there will be changes. And it's a very good example of how new stuff shows up all the time, and why you need well-funded scientists and educators to address things that nobody had ever seen before. And that's what science is good at. It takes stuff we've never seen before and tries to figure them out so we can work with what we got. All right, you be well. I'll have another one of these for you next week sometime, and keep up with your work, okay? So long for now.